I now recognize any member wishing to ask questions of the witnesses. Members may ask questions of the witness for 5 minutes.
You talked about increasing education for those who currently are uninsured, and I was just curious as to how you propose we initiate these education initiatives.
Well, that's a very good question. I think it's educating them on the types of programs that are out there. But I think more importantly than anything is to educate them on why it's important that they need health insurance.
You have challenged us to take a look at the true cost of health care. As a member of the health insurance industry, would you consider raising that amount of the dollar by cutting administrative costs and realizing the benefit of having a health and welfare-based system as opposed to a cost and profit-based system?
First of all, I would not support that. And I would tend to disagree with you as far as being able to provide a better coverage. If that was the case, people from countries abroad would not be coming to the United States to seek medical care. Limiting somebody on how much money they can make, I think, is asking for problems. You're talking about cutting down administrative costs. Where do you cut that cost down?
In one case, when we speak of persons coming from other countries to the United States, my experience has been essentially the reverse. More interesting is the major growth industry known as medical tourism, in which people are leaving the United States and going elsewhere. India comes to mind, to get medical procedures because they are so impossibly expensive in the United States. There's a system called Charge Master that keeps up with all the costs. You've heard of the $500 hammer. What about the $20 Band-Aid or the $50 aspirin? This is a Medicare card. I'm holding up another card that says Blue Cross on it. This is a Medicare supplement card. The private insurance industry can complement, and this happens in other countries too, the single payer or government provided insurance and maintain its business position. It's done with Medicare in this country. It can be done with programs in the future.
You know, not every physician takes that card. They choose not to operate under that program because the reimbursements are too low. I think the best way to reduce the cost is to educate people on the importance of having health insurance. The more people that have health insurance, the less percentage of the cost of health care will have to be built in to pay for those people who show up that don't have health insurance.
I believe Mr. Rice has just made the argument for universal health care. Because if we get everybody into it, we will reduce the cost of our health care the most.
No, not at all, not at all, not at all. What I'm making the argument for is to educate people on the need for health insurance. Universal health care does not cover that, does not achieve that. Why would you create a universal program that's still going to leave 25 million people uninsured?
Well, by definition,
No, go ahead.
By definition, you would not have created a universal health care program because you wouldn't have left the 25,000 people out.
Yet that's what's on the table. It's on the table right now, still leaves 25 million people uninsured at the end of 10 years. The punishment doesn't fit the crime. The proposed health insurance reform right now on the table does absolutely nothing to penalize those people who do not select health insurance.
Again, I submit that what you have argued is a demonstration that indeed what we need is universal health care, because that's the only way we're going to have an actuarial and least cost system.
Absolutely not.
Your argument only goes to the current legislation, and my understanding is the committee is here being asked, or asking us to inform them as a matter of public policy, what are the issues and how might those issues be best solved. I would submit that the line of argument you presented shows that they would be best solved by universal health care.
That is absolutely not what I'm
Thank you, gentlemen,
mentioning
but
here.
I'm going to cut you off.
What do we do to reduce the cost when so much of the expense is spent on doctors ordering tests, expensive tests?
Every time you have a patient come in, they're going to run every test they can imagine, because if they don't and something happens to that patient, they're going to be sued.
You mentioned why does a Band-Aid cost $10? Again, it goes back to the fact that Medicare, Medicaid does not pay their fair share, and they're forced to do these stupid little gimmicks on pricing. And again, once the government decides that they want to pay their fair share, then we can probably get these Band-Aids costing pennies the way they're supposed to.
Again, I would submit that's because the system is so scattered that things like the $20 Band-Aid are being used as gimmicks to make it work.
Right.
So we've got a fundamental, I would call it non-systemic problem.
And is this being caused by the government, or is this being caused by insurance companies?
I think it's a combination of all the players.
For those people out there that think universal coverage is the way to go and the way to drive down health insurance costs, I caution you to look at Medicare and the fact that Medicare is going broke today, and the fact that people think that insurance premiums from insurance companies are raised every year to raise profits. You have a Medicare card. How often does your Part B premium go up every year?
It's one thing to keep diving into the river time and time again to save people and get them back to the shore. It's another thing to go upstream and find out who's throwing them in. And that's what we have to do.
Thank you.